Celia from Elevate, and today we're going to be talking through a bit about what to expect if you're coming in to see us for a pessary appointment. So first and foremost, we're going to ask you a whole heap of questions to figure out why you're here, what we can help with, and what all our options are. And of course, we want to answer any questions that you've got as well, because some people know a bit about prolapse and pessaries. You might have a friend that's got one, or heard of someone else that might be using one. And other people don't know much about them at all, and it's all very new. So we want to make sure we've answered all of your questions to make sure you feel really confident with the choices that you make going forward. And of course, you're never pressured into anything. You can decide not to do this at any point, or we don't mind. We just want you to be happy and know all the choices that you've got available to you. So firstly, with the pessary appointment, what we're going to go through is talk a bit about the different pessaries, what they do, what they're made of, so you understand. So different pessaries that we stock are made of medical grade silicone. They're nice and bendy and stretchy and really kind on the vaginal tissues. All of the pessaries fit inside the vagina, so how we need to assess where they're going to go is to do a vaginal assessment. So we do that with gloves on, with our hand, to measure what shape and size pessary is going to be the best for your type of prolapse or bladder leakage. And then we also need to do a speculum assessment to check the integrity of the vaginal tissue. So we've got a baseline of what your body and your tissues are like before we start using the pessaries. And if there is any concern about the tissues, that they might be at risk of any irritation from the prolapse, then we'd be talking to your other healthcare providers about what we need to do to get you to the point where you could trial this. So for the speculum exam, what we do is we use a clear plastic speculum and we use a light so that we can see when we open up and check all the tissues inside. Depending on your body shape as well, or if you've got any history of pain with speculum exams, we can use a smaller size speculum. So bonus, if you didn't know about this, they have these at all of your medical practices as well. So if you do have a history of pain with speculums, ask for the small one. Makes a really big difference. If you do have discomfort, it's about half the size, so really worth doing if you need to. But what we're doing is we're checking what those vaginal tissues look like, and we do this at all of our follow-ups so that if there is any problems from the pessary, we can catch it early and get onto it before there's any other further complications. So with the pessary, once we've done our measure for what shape or what size, we've checked and made sure everything's safe to go ahead, then we look at trialing them. So we've got these kits here that have the different pessaries that we offer in sizes 0 through to 9. So it's a really big range. The most common size that we use would be a size 3 to 4. So pretty much in the middle of that. And we then test out from our fitting kits. We insert the pessary for you and then we test it out. So we get you to do the things that you'd normally feel your bladder leakage or your prolapse with. So we get you lifting some weights, we get you jumping up and down, we get you coughing. We've got some little mats underneath in case there's any accidents as well. So we want to really test it out in the appointment so that if it works, you're confident with it. And if it doesn't work, we can try something else and you haven't been sent home with something that's not going to work for you. So once we've tried it, and sometimes it takes us a few different pessaries to go up a size, down a size, different style. Once we've got the one we think is going to be the best for you, we will then give you that one, and we can either teach you how to put it in and out yourself so that you go home feeling confident you can manage it, or if you're not wanting to do that, which is totally fine, then we insert it for you so you can go home with your pessary. Normally, after you've had the pessary inserted, you should notice a complete change in your symptoms. So we want the pessary to be really effective, either completely resolve your symptoms or it needs to make them significantly better. If you're like, I'm not sure, is this really doing anything for me? It's probably not the right pessary. It needs to be really clear. So over the next 1 to 2 days with the pessary, you should be like, yes, this is what's working for me, because you'll be able to do your normal day-to-day life and feel heaps better with it, more comfortable, more confident, maybe even doing some things you've been avoiding for a little while because you're feeling so good. If not, you're going to be, oh, this just feels pretty much exactly the same. If anything feels worse, you call us straight away so we can get you in for an urgent appointment. We always have appointments reserved for people if they're having issues with their pessary. So essentially we go from You come in for the appointment, we fit the pessary, you go home with something that ideally works first time, but if it doesn't, we can get you back quickly to adjust that. Our normal follow-up then from when we've got the right pessary is 2 weeks after that. We like to do 2 weeks. That's slightly shorter than the international guidelines for pessary management because I don't like to leave people 6 weeks to 3 months if the pessary is not working. So I want to get you back in 2 weeks to know, is it working? How are we going? Do we need to change anything? How are you getting on with managing it? Have you been able to test everything else that you wanted to out so that we know this is the right pessary for you? And then we do our speculum check, make sure everything's happy and healthy in the vaginal tissues, no irritation, no problems. And then we're good to go. We're going, great, this is the pessary for you. We then would see you 3 months later doing the same checks, the same reviews, and then if all's going well, we see you 6 months later. At that 6-month review, we're then deciding what we're going to be doing long term. For people that are taking the pessary in and out themselves and self-managing, we then go on to seeing you once a year, which is pretty awesome. Whereas for people that are leaving it in themselves, then we only have to see you every 6 months, and all of these long-term appointments are only 15 minutes. So it's just a quick check to make sure internally the vaginal tissues are happy and healthy. Because one complication with the pessary, when it's contacting your vaginal tissue, it can create a little bit of rubbing or irritation. So kind of similar to if you get a new pair of shoes and you're in the shop, you're like, these feel great, super comfy, no problems. But then you go home and start wearing them and you go, oh, actually, I'm getting a little bit of a hot spot. We want to catch that before it turns into a blister, right? So that's what we're doing with all our speculums, is making sure there's no early signs of irritation internally, because that would mean we need to take the pessary out, have a break, make sure the tissues are healthy again. And why that happened? Do we need a different pessary or something else? We do a bit of troubleshooting with that to make sure that we're setting you up with something you can use long term to help manage your symptoms, if it's going to be a long-term option. So that's our basic how-to for the pessary fitting appointment, and then also what we'd be doing long-term to manage that. With the long-term management, that can be with us or it can be with another healthcare provider that's competent with managing the pessaries, like a nurse practitioner or your GP, but the timelines are similar. That's just based on the international pessary guidelines for management for that prevention of complication. So hopefully that's answered a few questions about what you might experience when you come into our appointments. If you've got any questions about that process, anything you think I've missed that we should have added in, or any other questions, please pop them in the comments below. We'd love to answer more questions about pessaries and prolapse. We get asked a lot of them, so we know it's something a lot of people are thinking about and wondering about, which makes sense because prolapse is really common and it impacts so many people in so many aspects of their life. So we love being able to provide something like this that can make that huge difference straight away.